Grant.
Oh, yeah, I've been waiting here for 3 hours.
Yeah, I'm Dr. Brisk. Please come in. Now, why are you here?
Well, the nurse called me and told me I needed to come in and see you.
Okay, it's about your blood test results. So I haven't had a chance to have a look yet, but let's just. HbA1c 42, uric acid raised, triglycerides 4, and I've just seen your blood pressure's been taken. It's 150/95. Yeah, those aren't looking good, but don't worry, they're no worse than mine. So it looks like you've got about 4 different conditions here. You've got high uric acid, which puts you at risk of gout. You've got high blood pressure. You've got abnormal lipids. But don't worry, I can start you on some medication straight away, and it'll take care of it. So here's a prescription. If you take that to the pharmacy, never stop taking them, and come back in about a week's time, and the nurse will check your blood pressure. Thank you, Grant. Grant.
Oh, g'day, Glenn. Good to see you.
Good to see you again.
Yeah, how are you?
I'm good. I've been thinking of you. How's Louise?
Oh, she's pretty good. It's pretty busy, yeah.
Sam and Jackson?
Yeah, they've got this new stuff, but they're out there doing some good work. I think they're going to make a go of it.
Hell, they're good-looking boys, aren't they?
Yeah, well, I don't often think about that, but yeah.
And Danny?
I just had his birthday. He's 14, so he's growing up.
Hey, thank you for coming in. The reason I've asked you to come in is I've got some concerns about your blood tests.
Oh, yeah.
So I've got them up here on the screen so we can look at them together.
Yeah.
So HbA1c at 42, that puts you into the pre-diabetic range.
Yeah, is that bad?
I'll go through the rest of these and then we'll talk about it globally.
Yeah.
Uric acid is raised.
Yeah.
The triglycerides are elevated, and the blood pressure's a little bit high. Is that unexpected?
Well, I sort of been busy this morning, so I'm not surprised my blood pressure's up a bit, but yeah, probably, I haven't probably been paying much attention to how I live. Yeah, and over the last few months, yeah, things got a bit busy. Got this diabetes project.
Tell me a little bit about your diet.
Well, it's a bit embarrassing. Ages ago, I wrote this keto book and everything, and that was really successful. I was good then, but I think I might be a little bit addicted to carbs and stuff because it creeps back in, and then the boys they're young, and then they'll bring home a pizza, and it's such a shame to throw it away. And I'm quite partial to. Actually, Dad died in December, which you were really involved with, and I thought that was a bit stressful. And then I think things just over the summer, rather than being my normal active self, I probably just was having chips and beer every night.
Yeah, the chips and beer diet. Not usually recommended.
Yeah, not really that good for your professor either.
Yeah, so we're looking here at metabolic syndrome, aren't we? The consequences of insulin resistance.
Yeah.
We don't have 4 separate conditions here. We've got one condition.
Yeah.
And I think we've got a choice. We can treat each of those with medications, or we can assess it with a lifestyle management program. Would that interest you?
Yeah, I need to walk and talk and do what I'm supposed to do. So I probably don't think the medicines, and this needs to go really because it's embarrassing. You can't really be a professor of public health.
All right. Well, if you'd come with me now, I'd like to introduce you to our health coaching team. I'm only going to talk very, very briefly, but a summary of the aims of today's event. This event aims to bring together members of the health and medical profession to share insights and experiences and collectively create strategies to influence the way that healthcare is delivered to individuals and communities with prediabetes and type 2 diabetes in primary care in New Zealand. We highlight where we have come from, where we've got to, and where we are heading in terms of healthcare in this context, with a model being proposed that integrates a whole food, carbohydrate reduction dietary approach with supportive and holistic delivery based on the health coach approach. What I hope we've highlighted with our unprepared skit, you wouldn't have expected Grant and I to have practiced it, would you? Really trying to highlight the difference between a consultation and a broken general practice with long waiting times, no continuity of care, a paternalistic approach, dealing with the symptoms and not the cause of the problem, resulting in prescription medicines only, and a disempowering result. Compared with the second scenario, a consult within a functional general practice, which is not overloaded. You have a relationship with your doctor due to continuity of care, using the health coach approach and providing choice, dealing with the cause of the problem and not just the resulting symptoms, and recognizing that a majority of people that we are seeing with chronic health conditions have metabolic syndrome secondary to insulin resistance, and treating that as a single condition, not treating each of the individual resulting symptoms. And this approach is empowering. It creates independence and self-reliance. It's patient-focused. Both of those consultations can be completed in 15 minutes, but I think only easily if you're able to do the handover to the coach. I think that's really the key element. One, it allows you to do that consultation within the limited timeframes that we have in general practice, but it also provides the continuity and the follow-up, which is just so important, which Jen and David will expand on. So scenario 2 results in grateful patients. It results in joyful doctors, and that is what is missing so much within general practice. You know, it changes the way you feel about going to work. It stops you wanting to retire at 55 and thinking, is 80 too old to still be working? And I think most importantly, it can potentially decongest an overburdened primary healthcare system so that you actually have time again to be the doctors and health professionals that you were trained to be. So condensing that purpose, for me, I would like to explore today the option of introducing a new model of general practice using whole food nutrition and metabolically trained health coaches to create a new version of primary care.